High-functioning depression, often referred to as dysthymia or persistent depressive disorder, is a mental health condition characterized by a chronic, mild depression that is less severe than major depressive disorder, but can be equally debilitating over time. It is termed high-functioning because individuals with this condition often maintain a facade of normalcy, holding down jobs, managing relationships, and performing daily activities with a semblance of proficiency. Despite their outward success, they internally grapple with pervasive sadness, low self-esteem, and a lack of enjoyment in life. Understanding high-functioning depression is critical because it challenges conventional perceptions of what depression looks like. Individuals with this form of depression are particularly vulnerable because their symptoms often go unnoticed and untreated. This can lead to misunderstandings and a lack of empathy from others who may not recognize the hidden distress. By acknowledging and addressing high-functioning depression, society can improve mental health awareness and support those who are silently struggling. Real-world examples underscore the presence of high-functioning depression. Consider the executive who consistently meets targets and appears charismatic at work, but feels emotionally exhausted and detached at home. Similarly, a college student might maintain high grades and a vibrant social life while internally feeling overwhelmed and worthless. These examples illustrate how individuals can mask their distress while their underlying struggles remain unaddressed. Mental health advocates emphasize the importance of recognizing and validating high-functioning depression. They argue that acknowledging this condition can lead to early intervention and support, preventing the potential escalation of symptoms. However, some challenge the concept by suggesting that labeling such experiences may pathologize normal variations of mood or resilience. One controversy involves differentiating between high-functioning depression and burnout. Both can exhibit similar symptoms, but burnout is specifically work-related, whereas high-functioning depression pervades all aspects of an individual's life. This distinction is crucial for accurate diagnosis and treatment. The recognition of high-functioning depression influences other aspects of mental health by broadening the spectrum of understanding and acceptance. It promotes the idea that mental health conditions can manifest in diverse ways and stresses the need for personalized approaches to mental health care. By highlighting this condition, a more inclusive dialogue on mental health is encouraged, reinforcing the notion that seeking help is a strength rather than a weakness. High-functioning depression, often referred to as persistent depressive disorder or dysthymia, is a condition characterized by a chronic state of depression where individuals maintain the ability to manage everyday tasks. Unlike major depression, those with high-functioning depression may appear outwardly successful, going about their daily routines and fulfilling responsibilities, while internally struggling with persistent feelings of sadness, low self-esteem, and fatigue. The significance of defining characteristics and symptoms lies in its ability to help individuals and healthcare professionals identify those who might not fit the typical profile of someone suffering from depression. Recognizing these signs is crucial in providing appropriate support and treatment, as individuals with high-functioning depression are often overlooked due to their apparent external stability. For example, a corporate executive may continue to excel at work, meeting deadlines and achieving targets, yet experience a sense of emptiness and hopelessness outside the office. Similarly, a student might maintain a high GPA while struggling daily with pervasive feelings of inadequacy and despair. These examples illustrate how high-functioning depression can mask itself in environments that prioritize tangible achievements, making it difficult for others, and even the sufferers themselves, to acknowledge the need for help. The recognition of high-functioning depression has garnered support from mental health advocates who emphasize the importance of understanding that depression manifests in various ways. They argue that societal expectations of productivity should not overshadow mental health needs, as those with high-functioning depression often push themselves to meet these expectations at the cost of their well-being. However, there are challenges and controversies surrounding this concept. Some critics argue that labeling certain individuals as having high-functioning depression may minimize the severity of their experiences or contribute to the stigma that discourages seeking help. Others question whether separating high-functioning depression from other depressive disorders creates unnecessary distinctions that complicate treatment. This point connects to other aspects of mental health by highlighting the importance of recognizing diverse manifestations of depression. It encourages a broader understanding that goes beyond visible symptoms, prompting a more inclusive approach in mental health care and advocacy. By identifying and addressing high-functioning depression, we can better support individuals who might otherwise be left to cope alone, ultimately fostering a more compassionate and comprehensive mental health framework. High-functioning depression, often overlooked, masks itself in the guise of a busy, outwardly successful life. Understanding the causes and risk factors of high-functioning depression is pivotal in shedding light on this elusive condition. At its core, high-functioning depression, also known as dysthymia or persistent depressive disorder, refers to a condition characterized by a chronic state of low mood. Individuals may appear to be fine or even thrive on the surface, maintaining jobs and social relationships. Yet underneath, they struggle with pervasive feelings of emptiness, fatigue, and a lack of genuine joy. The significance of examining causes and risk factors cannot be overstated, as it facilitates both early recognition and intervention, potentially averting more serious mental health issues. Genetic predisposition plays a significant role. Individuals with a family history of depression may be at an elevated risk. Chronic stress, whether from personal relationships, work, or financial struggles, can also contribute significantly to developing high-functioning depression. Childhood trauma or prolonged adversity may set the stage for later depressive disorders. Furthermore, perfectionism, often lauded in high achievers, can exacerbate this condition, leading individuals down an exhausting path of relentless self-criticism and unmet expectations. Consider the example of an employee who consistently meets deadlines and receives accolades for their work performance. While appearing polished and poised internally, they might struggle with feelings of inadequacy and a persistent low mood, turning to unhealthy coping mechanisms such as substance use or isolation. Similarly, think of a college student maintaining stellar grades and an active social life, but secretly battling fatigue and a lack of motivation. Opinions from mental health professionals emphasize the need for awareness and preventative strategies that focus on emotional education and resilience building. Recognizing these factors can prompt crucial conversations and timely assistance, allowing individuals to seek help before the condition escalates. However, challenges in this domain are significant. The very nature of high-functioning depression means it's often dismissed or undiagnosed, as the symptoms may not match societal expectations of how depression should look. Some argue that labeling such individuals as depressed could be reductive or pathologizing, shifting focus from genuine resilience to problematic traits. This exploration of causes and risk factors is intimately connected to the broader spectrum of understanding high-functioning depression. By identifying and addressing these foundational issues, other aspects, such as treatment and support mechanisms, can be more effectively tailored, ultimately assisting individuals in leading more fulfilling and less burdensome lives. High-functioning depression, often referred to as persistent depressive disorder, represents a complex and somewhat misunderstood facet of mental health. This condition is characterized by a chronic form of depression, where individuals experience a pervasive, low-grade depressive symptoms. Unlike major depressive disorder, individuals with high-functioning depression might appear to be managing their daily lives effectively, maintaining employment, academic pursuits, or social engagements, despite the internal emotional struggle. The significance of discussing diagnosis and misconceptions lies in its potential to illuminate the struggles faced by individuals who seem outwardly functional. By understanding these dynamics, we can foster more empathy and awareness, improving societal support and decreasing stigma. An example illustrating high-functioning depression is a successful professional who excels at work, meets deadlines, and interacts with others effortlessly, but copes with a persistent internal sense of hopelessness and inadequacy. Another example is a student achieving high academic standards while privately battling pervasive sadness, self-doubt, and an inability to find joy in accomplishments. These scenarios highlight how high-functioning depression can be hidden behind a veneer of competence and achievement, often delaying diagnosis and treatment. Many mental health professionals emphasize that recognizing high-functioning depression is crucial, as it underscores the reality that depression does not always look the same and can affect anyone, regardless of outward success. Understanding this concept helps address the prevailing misconception that depression must be debilitating to be legitimate. However, identifying high-functioning depression comes with challenges. One major issue is the potential for symptoms to be dismissed as mere stress or tiredness, both by the individual and society, due to their ability to function effectively. This can lead to underdiagnosis and untreated mental health issues, perpetuating a cycle of suffering. Additionally, the stigma attached to mental health, particularly in cultures that value high achievement, can further suppress individuals from seeking help. The discussion of diagnosis and misconceptions intricately links to other aspects of high-functioning depression, such as treatment and coping strategies. Misdiagnosis or ignorance can significantly impact the effectiveness of treatment plans, which are essential for improving the quality of life for those affected. By demystifying what high-functioning depression looks like and addressing misconceptions, we can pave the way for more informed conversations, encouraging individuals to seek appropriate support and fostering environments where mental health is prioritized alongside apparent success.